Hello everyone and welcome back. In medical affairs and particularly for MSLs and field medical teams, strategic engagement with key opinion leaders is the most important role in our job descriptions. These engagements with key opinion leaders are not only about building relationships, but most importantly, they are about generating meaningful insights that can drive scientific discussions, inform our strategies, and ultimately improve patient outcomes. In other words, about generating meaningful and actionable insights. And in order for you to generate this type of insights, we must master two critical skills. First, the ability to ask the right probing questions. Second, the ability to properly document the data, facts, and observations that emerge from every single engagement. So today, we will focus on both those two essential elements and the technical skills needed. We will begin by exploring different types of probing questions, where you will learn how each type of questions align with the specific engagement objectives and broader organizational strategy. Then, we will shift our focus to the documentation, where we will discuss how to capture data, facts, and observations from our key opinion leader engagements. So let's begin with the probing questions and their strategic importance. Probing questions are essential tools for MSLs. They allow conversations to go deeper and relieve insights that would otherwise remain hidden. The type of probing question you choose should always align with the engagement objective and the broader medical strategy. Because when you ask the questions thoughtfully, you will be able to guide the discussions and to gather targeted, meaningful information that shapes both the medical and also business decisions. Now, let's explore the key types of probing questions with practical examples for each. First, we have the clarifying questions. And this type of questions help to ensure shared understanding. They are useful when topics become complex or when the MSL needs to clarify and clearly understand the key opinion leader's perspective. For example, if your objective is to understand a key opinion leader's view of a new clinical data for a treatment, let's say in advanced cancer, a clarifying question could be, can you clarify how you see this new data influencing your current treatment approach for patients with advanced cancer? Such insights coming from this question will ensure that the MSL fully understands how the key opinion leader will translate the clinical data into real-world practice. So clarifying questions can generate insights that can be used later to refine messaging or develop targeted educational programs. Second, we have the exploratory questions. And this is the type of questions that can open broader discussions. They encourage the key opinion leader to share experiences, challenges, and unmet needs. For example, if the objective is to identify unmet needs in a disease area, let's say heart failure, a question might be, what challenges do you see in managing heart failure patients with current treatment options? The response may reveal gaps in care where future strategies, studies, or even educational initiatives can be helpful. Third, we have the comparative questions. And these questions invite the key opinion leaders to scientifically compare therapies, approaches, or outcomes. They help to reveal preferences, decision-making criteria, and perceived advantages or limitations. For example, if the objective is to understand how a new therapy compares to the standard of care, a comparative question could be, How do you feel this new treatment compares to the current standard therapy in terms of efficacy and safety? And the insights that can come from answering this question will help the MSL to adjust communication to better align with the key opinion leaders' priorities. Next, we have the hypothetical questions. And these type of questions can explore future scenarios. They help you to assess how the key opinion leader might respond to new data, new guidelines, or emerging evidence. For example, if the future data will show that this new mechanism of action can significantly reduce hospitalization in heart failure patients, how do you think this would change your current treatment approach? Answering such a question will help the MSL to understand what conditions might drive adoption or change in practice in response to the new medication with a new mechanism of action. And of course, as you can expect, these type of questions are very important during the medical pre-launch preparation. The fifth type of questions we can ask our key opinion leaders is the insight-generating questions. And these questions aim to extract practical insights about clinical practice, about patient management, and real-world challenges. For example, to understand the adherence challenges, a question might be, what are the most common reasons patients struggle with adherence to their treatment regimen? The insights gained from this question can inform patient support programs, communication strategies, and educational programs. Sixth, we have the validating questions, which confirm or test information. They help to ensure alignment between the key opinion leader perspectives and the broader trends or data. For example, based on new guidelines, do you find yourself changing your treatment approach, or does your current practice already align with them? This helps to assess the guideline adoption and identify areas where further education may be needed. The seventh and probably the last type of questions for today is the reflective questions, which encourage deeper thinking. They often uncover long-term trends and qualitative insights. For example, looking back over the last few years, what do you think has been the most significant shift in how we manage those patients with chronic disease? The response of these questions can help us to understand where this field is heading and how to align future initiatives. So these were the 7 types of questions, and I think your focus should be on only one type per key opinion leader engagement. So prepare one objective with the relevant one question for each key opinion leader meeting. And that's how you can generate multiple meaningful and actionable insights related to your objective, which is already aligned with your medical strategy. Now, let's move to the documentation parts: data, facts, and observations. First, data refers to the quantifiable information that you get during the key opinion leader meeting. It includes maybe numerical values, metrics, measurable outcomes shared during the engagement. For example, a key opinion leader may share trial results showing 25% reduction in adverse events, or showing patient demographics and response rates. This data can support evidence-based insights and strategic decision-making. On the other hand, facts are verifiable statements. They provide context and anchor discussions in reality. For example, a key opinion leader may mention updated clinical guidelines or the adoption of new hospital strategy or protocol. These facts help you to ensure that the insights reflect the current clinical landscape in your region. And finally, we have the observations, which are subjective insights based on experience and clinical judgment of the key opinion leader. For example, a key opinion leader may note that patients express concerns about certain side effects, or that the outcomes improve when therapy is combined with lifestyle changes. These are observations. They may not always be supported by any hard data, but they can provide critical real-world perspectives. So, here is what every MSL should do after each key opinion engagement. Again, 7 things. First, document every takeaway immediately. Capture the data, facts, and observations while the information is still fresh. Second, categorize and tag this information. Organize the insights by therapeutic area, product relevance, or strategic focus to make retrieval easier later on. Third, align the insights with your engagement objectives. So here you have to review your original goals and objectives and assess how the discussion that happened supported them. The fourth thing you have to do is to identify information gaps. Note the unanswered questions or topics requiring follow-up. Fifth, you summarize for 2 purposes: reporting the insights, of course, and for sharing them with internal stakeholders. So here you can create a concise summary highlighting the key insights, their implications, and actions that are expected. The 6th step is to record the follow-up actions and document the next steps, such as sharing data or scheduling another discussion. The 7th step you have to make is to store everything in a central system, and this will ensure continuity, visibility, and alignment across your organization. So to conclude this session, we have shown how MSLs can elevate key opinion leader engagements through strategic questioning and structured documentation after each key opinion leader engagement. Ladies and gentlemen, by asking the right questions and capturing the right insights, each interaction becomes meaningful, actionable, and strategically valuable. Thank you for joining this tutorial, and I hope these strategies help you elevate your impact in medical affairs. See you next time. Thank you.